Today, we're focusing on the front door of our healthcare system, outpatient facilities. These are the vital centers where patients receive treatment, consultation, and care without needing an overnight stay. Their design is critical as they must be efficient, safe, and above all, accessible. Proper planning ensures they can serve their communities effectively. Let's explore the foundational requirements that make these facilities work. Part 1. The general framework. Building for purpose and people. First, it's important to know that these standards apply broadly to outpatient units within hospitals, to freestanding clinics, and to medical offices within larger buildings. We recognize that specialty centers, like those for dialysis or mental health, will have unique needs that go beyond this baseline. A core principle is that these facilities are designed for ambulatory patients, those who can move independently or with the aid of a wheelchair. This focus directly influences everything from the layout to the safety protocols, which must rigorously comply with national life safety codes. Now, let's talk about the patient's journey, which begins with access. The main entrance must be at ground level, clearly marked, and easy to find. Once inside, the design must protect the patient's experience. This means creating clear, dedicated pathways that prevent unrelated foot traffic from disrupting the calm, clinical environment. Even in a shared building lobby, the route to care should be distinct and respectful. Every facility must be built around a clear functional program, a blueprint that defines its specific purpose, the services it will offer, and the exact space required to deliver them. Furthermore, if services are shared or purchased from another provider, our designs must be smart and adaptable to avoid wasteful duplication of space and equipment. Location is another cornerstone of accessibility. A facility must be situated where the community it serves can actually reach it, with strong consideration for public transportation and adequate parking. And while parking is essential, we can be flexible in high-density areas with excellent transit links, adjusting requirements with local approval. Finally, woven through all of this is the non-negotiable principle of patient privacy. Our designs must safeguard both visual and audible privacy at every stage of the visit, ensuring that patient dignity and confidentiality are never compromised. Part 2. The common elements. The spaces that serve everyone. With that framework in mind, let's look at the common elements that form the backbone of any outpatient facility. Starting with administration and public areas, the entrance must be at ground level and fully accessible. The public spaces should be equipped to welcome everyone comfortably, featuring a clear reception and information desk, well-designed waiting areas, accessible public restrooms and drinking fountains, and crucial support features like wheelchair storage and private interview rooms for sensitive discussions about billing or social services. Behind the scenes, we need functional spaces for staff, offices for administrative work, multi-purpose rooms for patient education and meetings, and secure storage for both personal belongings and essential supplies. A critical technical note: if a facility provides services like dialysis, it must have a dedicated, separate water supply and drainage system to meet clinical standards. Moving into the clinical facilities, this is where care is delivered. The core of this area is a suite of purpose-built rooms. Exam rooms for patient evaluation, treatment rooms for procedures like wound care, consultation rooms for private doctor-patient conversations, and observation rooms for monitoring patients who need short-term care before being discharged. If the facilities program includes diagnostic services, it must also house a proper imaging suite for X-rays, MRIs, or other necessary scans. In conclusion, designing an outpatient facility is about creating a seamless, respectful, and efficient patient experience from the parking lot to the exam room. It requires a careful balance of strict standards and thoughtful flexibility. By adhering to these principles, we can build outpatient centers that are not just clinics, but true cornerstones of accessible, dignified, and effective community healthcare. I hope you enjoyed the video. Would appreciate it if you'd like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. I remain your host, Sunday Clement. Thanks for listening.